The information found in this podcast is not intended to be a substitute for treatment from a licensed mental health professional. Thank you for listening to the Honeybee Podcast, Episode 7. Today, we are discussing ideas for parents to consider while caring for a child who engages in disordered eating behaviors. And we will share considerations to be mindful of prior to taking a child to therapy. To help with the conversation, I have invited Dr. Lindsay Ricciardi. Lindsay Ricciardi, PhD, is passionate about helping others develop a healthy relationship with food and their bodies. A licensed psychologist, she has worked as a clinician, teacher, mentor, and researcher in the field of eating disorders and related concerns for 17 years. Dr. Ricciardi received her doctoral training at the University of Nevada, Las Vegas, Department of Psychology, and then completed a specialized internship and fellowship at the University of Chicago Medical Center, Department of Psychiatry, Eating and Weight Disorders Program. Dr. Ricciardi is certified by the Institute for Child and Adolescent Eating Disorders and has been comprehensively trained in dialectical behavior therapy. She is the co-author of multiple publications in the field and has presented at many national conferences, businesses, and community events. She is a past president of the Nevada Psychological Association and currently serves as adjunct assistant faculty at UNLV. She is currently in private practice in Las Vegas, Nevada. Without further ado, let the conversation begin. Thank you so much for tuning into today's episode of the Honeybee Podcast. Today, I have the good fortune of sharing a message that I received from a concerned parent, and I have a very important person here to be of support in helping this parent with problem solving. Here is the letter that I received. Dear Honeybee, my 14-year-old daughter has been an athlete for many years, being active in sports like volleyball, tennis, and now swim. A couple of months ago, her swim teacher told her that if she did not have such big thighs, that she could swim faster. Since that time, my daughter often checks in with me and her siblings about how she looks in her clothes. She examines her body in the mirror and checks her weight, to my knowledge, twice a day. My daughter used to eat healthy portions of food and now only eats half of her previous intake. She's begun refusing to eat around us and no longer participates in our family dinners on Friday. When I confront her about what I notice, she gets defensive and shuts down. I'm worried that my child is developing an eating disorder. What can I do to help? This parent absolutely has a valid concern, and in order to provide this person with the most effective information and advice, I have here with me Dr. Lindsay Ricciardi, a licensed clinical psychologist who specializes in the assessment and treatment of eating disorders and related concerns. In addition to completing a focused internship and fellowship in eating disorders, she's certified by the Training Institute for Child and Adolescent Eating Disorders. Dr. Ricciardi?
Yes.
We have a concerned and observant parent who's worried about their daughter. Specifically, this parent is worried about their daughter developing an eating disorder and is curious to know how to help. I like to ask my guests to identify a quote, a passage from a book, or general message to share with the listeners that will shape today's conversation. Do you happen to have a quote or some variation thereof to share with us today?
I do, actually. So one quote that always rings true to me in the work that I do and in general in life is that it's not about waiting for the storm to pass. Life is not about waiting for the storm to pass. It's about learning to dance in the rain. Oftentimes we wait for things to be calm and peaceful, and then we'll do what we want to do, but that's just not the way life goes. So, we have to be ready to tackle difficult situations as they're occurring, like in this case that you brought up today.
I absolutely love that quote, and I am so happy to be sharing this space with you. Thank you so much for being on today's episode.
Oh, you're welcome. And thank you so much for having me and bringing awareness to such an important issue that I think so many parents just don't really know the right things to do to support their adolescents. So thank you for having me.
My pleasure. I think the most important step to have in this moment is to first, let's define what an eating disorder is. Can you please share with the listeners today what is the definition of an eating disorder?
Great question, because there's so many myths about what eating disorders are and are not. And I like to say that first and foremost, eating disorders are clinically significant psychiatric disorders that impact a person's functioning in many areas of their life. But the most important characteristic to me is this heightened obsession and preoccupation that really takes a tremendous amount of cognitive and emotional and oftentimes physical attention and energy. And I like to sort of explain eating disorders that it's almost as if, as the person becomes deeper and deeper into the eating disorder thoughts and behaviors, it's as if their world, the rest of their world, their friends, their social life, their hobbies, their interests, their, parts of their personality, like everything sort of starts to shrink. The world gets smaller and smaller. And I would say that's true pretty much across the eating disorders, that they take a lot of this energy to maintain, and people get really stuck in these patterns that are very, very hard to control. I also like to think about it as it's as if you have like a pocket bully just traveling throughout your day with you, telling you you're not good enough and what you should do and need to do in order to feel better, and to feel guilty when you engage in normative behaviors like sharing an ice cream with your best friend, so that there's this just constant self-talk that becomes really pervasive. And eating disorders are kind of different than a lot of our other psychiatric disorders in that first and foremost, they're psychiatric in nature, meaning they're going on in our thoughts and behaviors, but they also carry with them a lot of physical repercussions the more and more people start to act out in the eating disorder behaviors. So eating disorders carry some of the highest mortality rates of all of the psychiatric disorders, more so than depression, more so than schizophrenia. There's just a lot of risk involved in the behaviors associated with this psychiatric disorder.
Wow. I had no idea.
Yeah, a lot of people don't realize how risky eating disorders are. And, sort of going back to that question, it's just so critically important for us to have really good ways to detect them early and support men and women, children, adults, everybody that is starting an eating disorder, because we also know the research is really clear that the longer you have an eating disorder, the harder they are to treat, and the harder it is to get back to that pre-morbid or non-clinical levels. Not to say I never, ever, ever give up hope on anybody. So if somebody's had an eating disorder for 30 years and they want to get better, I will support that, and I believe that's very possible. It's just a lot harder compared to somebody that's been in an eating disorder for 6 months.
So, what experiences shape the development of an eating disorder?
So, great question. And I think sort of the best answer that I have come into is to think about eating disorders as a perfect storm. In 17 years of working with this population, I've never had a case that had a single risk factor. 9 times out of 10, there's multiple risk factors. And, the research suggests that this is some parts personality. I'll start with that. We don't necessarily inherit an eating disorder, but we can inherit the personality that breeds an eating disorder or that's more susceptible. So we know certain characteristics like being more perfectionistic or being more sensitive or being more anxious. For example, with anorexia, harm avoidance and being low on risk taking or sensation seeking. And I never saw this so clearly until I had 2 children that were raised with the same parents and same genetics and the same environment. And I'll never forget my son clutching my leg, crying hysterically the first day of preschool, as if I was going to drop him into a pit of snakes, like that kind of fear. And my daughter just walking in being like, "See ya, Mom." And so big difference in temperament that has nothing to do with how they were reared. And he was just born that way. And so we know that genetic personality, that predisposition to those personality traits, there's certain personality traits that are associated with eating disorders. And then with bulimia, it's more oftentimes you've got the perfection and the sensitivity, but then there's an impulsivity and more of that risk taking. And so it's interesting to see the different disorders, but we know that there's very clear personality risk factors. So that's one side. And then we start to get into all of the environmental triggers. And we also know just family history of things like substance abuse, family history of major depression. Anytime you start to stack up that psychiatric load in your genetics, you're going to be more at risk for an eating disorder. Environmentally, we live in, I think, what's often referred to as a very toxic environment for this disorder. And our culture has this normative level of body shape and weight obsession. And I say normative, not to say that the behavior is normative, but it's not considered clinical, right? For somebody to be doing their third 30-day cleanse or juice cleanse and focused on their weight and posting their before and afters and only talking about their diet and good food, bad food, that's not necessarily considered a clinical eating disorder, although I would argue that it's disordered eating. And it's very often on the spectrum of what can develop into a full-blown clinical eating disorder. So we have these toxic messages. One commercial is, get your 4th meal at Taco Bell, and then the next commercial is Nutrisystem and Jenny Craig. It's very confusing. And, I always encourage people to just take a peek at what the media throws at us. Like even at the grocery store, we're in the checkout line, how many of the magazines on the cover are either body shaming, highlighting somebody's cellulite, or reveling in somebody's weight loss and prescribing diets for how to lose that belly fat or thin your thighs. The messages are so constant that we don't even really notice them very often because they're just so a part of the fabric of our American culture. So we know really loud and clear that parents' views about their bodies and food and dieting are a really big predictive factor in the development of an eating disorder. And again, not to say that every household that has a lot of diet culture is going to create a child with an eating disorder. You have to have those genetics and oftentimes other environmental triggers happening at the same time. The first case I ever met was when I worked at a psychiatric hospital, my very first job. And it was a 13-year-old athlete who her boyfriend had broken up with her and made a comment about her body. And that was the trigger, that caused this cascade of thoughts and emotions and behaviors that developed into a full-blown eating disorder. And 95% of eating disorders start with a diet.
Huh. So, with that in mind, and referencing back to the letter that I read a moment ago, we have an athlete who's 14 years old. She has, it sounds like, been restricting food or not eating in the same way that she had prior to this invalidating statement that was made by her swim coach. She's examining her body in the mirror. She's checking in with people to find out how she looks in her clothes, and she's checking her weight twice a day. Also avoiding family meals, especially when that was, it seems like a highlight of the week for the family. So, do you share any concerns in the way that the parent has about this youth's new behavior?
Absolutely, 100%. All of my feelers and flags are on high alert when I hear about this case. And I feel like it's very reminiscent of how so many young men and women will start their eating disorder. So kudos to the parent who wrote the letter for recognizing that this is very serious and could be potentially far more serious and change the trajectory of this child's life if it's not addressed in a timely manner. The other thing that I've seen, though, is that sometimes parents look at a situation like this and they're pleased that their child, who was not at all into health behaviors, is now focused on eating healthy and being healthy. And you don't see my air quotes here, but taking care of themselves. Parents oftentimes will be like, wow, I was so excited. She used to eat all this junk food, which is a term I try not to use at all, but you'll hear it from parents. And now, she wants vegetables and she's cut out pizza and good for her. And so initially, oftentimes, and they very often are getting reinforced by peers, by other adults, by coaches. So good for this mom to realize, okay, this is not okay. This is not healthy. But sometimes it's in that spirit of health that eating disorders go undetected without intervention for way too long until they're severe.
So then, if this parent came into your office and had an opportunity, the good fortune of working with you, and the parent shared that, she wanted to help her child in the context of family and getting back to eating family meals and just restoring things, how would you approach that situation?
Well, I mean, I noticed when she wrote the letter that she mentioned the term confront. And I don't really know what that means, but I always encourage parents, like when you're going to talk to your kids about things that are very frightening to you, sometimes as the parent, your fear and love and just overwhelming concern, we're not always that great of addressing things in a manner that our kids are receptive to. And I think I would just sort of start right from the beginning to be really try to be open and warm and validating, and ideally doing it at a time when a meal isn't right in front of the child, at least initially, because one thing we know with the progression of eating disorders is that there is extreme heightened anxiety, on all fronts. So physiological anxiety to the point of shaking, panic attacks, hand wringing as the disorder gets more intense. So just really trying, maybe right before bed when things are quiet and you're together, but just addressing like that I'm really worried about you because I love you. And these are the reasons why I'm worried about you. And I'm here to help you and support you. And I also think it's helpful to validate the culture that we live in, to be able to say, like, it's really hard to always feel good about your body and your food with all of these messages that we're constantly getting. So I think that would be sort of the starting discussion. But also, eating disorders are very secretive by nature. It's incredibly difficult to have an eating disorder without having to hide and keep secrets. It's the nature of this illness. So we also don't very often have a good sense of how long this has been going on and how severe the behaviors are. So kind of right off the bat, I would encourage this parent to schedule a follow-up with a physician. And unfortunately, a lot of our well-intended providers are not very well educated about eating disorders.
Mm-hmm.
So I also recommend giving a call ahead of time, because sometimes docs can do more harm than good by saying things, well, medically she's great, so she's all good. Or after they've lost 10 pounds to say, well, her weight's right where we want her to be. She has a perfect BMI, which can inadvertently reinforce the behaviors of restricting, obsessive control over eating, body checking, and then as the behaviors get more severe, starvation, purging, laxative, diuretic abuse, all of that can be inadvertently reinforced when a doc says, you look great, don't worry about it. But I would recommend that she meets with her pediatrician and gets a really good workup with labs and EKG and blood pressure. And, very often the medical risks come in right away. I'm working with a young lady right now who's 13, and in 3 months, she's developed bradycardia, which is basically your heart rate really, really slows down to conserve energy.
Wow.
She's developed elevated liver function tests on her labs as her body is starting to break down. And this data is important for a lot of reasons, but oftentimes with our younger adolescents, not always the case, but oftentimes if those things are going on, they can understand a little bit sometimes. And I say sometimes because the nature of this disorder is an inability to recognize the severity of the behaviors. That's written into the criteria for the disorder. So you might have the most brilliant, sharp child in the world, which is often the case, but they're not able to comprehend or understand, or it lacks significance what they could be doing to their bodies. But sometimes having that medical data can be motivating to the patient and certainly to the family. So I would recommend that you get checked up right away, and then sort of depending on the severity moving forward from there, I'd encourage the mom right off the bat to check herself, check the family. What are the practices? What are the messages? We really want to focus on health and health behavior, and health is holistic. So physical, mental, emotional, social, spiritual health and well-being, and take the focus off of body shape and weight as much as possible in the household. So if mom's on a diet, or dad, goes to CrossFit instead of having his family meal and talks about how he shouldn't be eating his, burger or whatever, like that stuff needs to get a cap on it right away. Very often parents will have their own body shape and weight and food issues, and it's unrealistic to expect that those will all be resolved, but they can keep a lid on it, and they can change the culture of the household to take the focus off of weight. And you mentioned this young lady's an athlete, so the focus can be on physical function and strength. And, very often with these restrictive eating habits, their physical performance and their sport really starts to suffer in terms of strength and energy levels. So I think that's probably where I'd start, is just an honest conversation of the concerns, really trying to very quickly address the messages in the home, getting a medical workup, and then depending on the severity of the behaviors, take it from there. I mean, I would right away get rid of the scale. We don't want our adolescents swaying themselves, and especially obsessively. They're supposed to be, especially a 13 or 14-year-old, very often is supposed to be increasing in weight and mass at that point to develop into a young man or young woman, to be building on laying down solid bone. We have a very short window of time in life to have good solid bone mass. And one of the well-documented lasting side effects of eating disorders can be osteoporosis or osteopenia, where the bones, just your body didn't get enough nutrition to develop a solid bone mass early on in life. So we can talk about too, like depending on how severe, like what are the options for intervention, but getting rid of the scale, really helping to support the child. Media literacy is a really important. I think it's important for all adolescents to be understanding that what they're seeing is not real. When we're looking at billboards and magazines, that the models that do that are not representative of human shapes and sizes, and then put through photo touching and, red lighting. And by the time, you see people, they're really aliens, like, that's not a human being.
Exactly.
And then what websites are your kids on? Sadly, there's some really, really dysfunctional, I would say really sick web culture related to eating disorders and strive for thinness. There's like Thinspiration, Pro Anna websites, Pro Mia websites, and these are websites by people in their disorder who share tips for how to hide food at the table, or how to get. For a while there was a lot of information out there about like getting your thighs so they're not touching with photos, and ways to eat to lose weight for adolescents. So I right away just kind of put a check on the phones, make it very clear that those are not acceptable to be looking at. And, I think just also like, again, like if we're focusing on health and well-being, one of the side effects of an eating disorder, a very common co-occurring condition, is depression or anxiety. So making sure that we're checking in on those fronts. Eating disorders also have a very high suicide rate. And so that would be another important piece of this to be assessing and to keep an eye on, is the depression or the hopelessness that often comes with these disorders and with starving brains too.
You said very important things, and I really appreciate you, Dr. Ricciardi, for sharing with the listeners the holistic piece of approaching the child, the spiritual, the physical, the emotional, the mental, and ways to attend to this concern in a skillful, well thought out, and compassionate way. I really appreciate your discussion about media literacy. Oftentimes, I agree with you 100%. The images that we see are not realistic, and oftentimes the people are photoshopped and airbrushed to the gods. So we're not looking at an accurate portrayal of the human body in its true form when we are viewing it on the cover of a magazine or any other photograph. So I really appreciate you for that piece. Out of curiosity, before we wind down for today's conversation, is there any other pieces of wisdom that you would like to share with us today?
I think, just mainly like, in this situation when the parent gets concerned, that I think oftentimes we shy away from this idea that we are the parent and we do have control to some extent. And I think I really see this show up in food. And they're very often hear from parents like, well, if I make her sit down and eat, then she throws a fit and it's miserable for everybody. So we just let her have her salad and take it up to her room. I think it's really very much indicated. And if we talk about like what's the right thing to do as a parent, I think making good nutrition. And when I say good, I'm not talking about everything being super healthy necessarily. I'm saying good, solid nutrition where they're getting all of their food groups and they're getting enough calorically to sustain their growing bodies. I think we can be firmer about that an appropriate meal is just a non-negotiable part of being in this household. And that we're not going to be, and especially when we know that the drive is for weight loss and being a certain shape, when that's the driving force. Now, obviously, we might have different views if this is, some kind of GI issue, but oftentimes with eating disorders, there is a lot of GI distress because we're doing things to the body that it's not designed to do, like starve or self-induced vomiting. So very often you'll hear constipation and bloating and, gassiness. These can all be parts of the disorder. But I think parents, just like if your kid had to go on a medicine and they didn't like the taste of the medicine, you wouldn't say, all right, you don't like it, so you don't have to do it. We're going to give them what they need to thrive. And I feel like food, we need to start thinking similarly about food. So you mentioned like she's refusing to do these family meals. Right. Well, family meals are non-negotiable. And we're going to sit down and have an appropriate portion of a meal. I think that that's okay for parents to do. And I think that's a lot more effective than letting your adolescent go on restrictive diets.
I love that. Eating appropriate portions of food is non-negotiable in this family. Mm-hmm. Which to me, how that lands with me is that may feel unpleasant for the person on the receiving end. Mm-hmm. And, we're in this together as a family. And as a family, this is what we do. I would imagine that would strengthen the relationship in some way over time and express care for the child.
Absolutely.
Thank you so much, Dr. Ricciardi, for being a part of today's conversation. If people want to learn more about you and the wonderful work that you provide to folks here in Las Vegas, all across the country, and even all across the world, how can they find out more about you?
My website is lasvegaseatingdisorders.com. And so you can read about me and my practice and services we offer.
Excellent. I hope that you have a wonderful rest of the day. Thanks again.
Thank you so much. I've had a wonderful time, and I'm so glad that this information is going out to the folks that need it. So thank you.
My pleasure. Take good care.
All right. Bye-bye.
Bye. That was a wonderful and overall super informative conversation with Dr. Ricciardi. Dr. Ricciardi shared a tremendous amount of her wisdom and expertise in that conversation. A couple of things that stood out to me included the invitation for parents to acknowledge their emotional experience after they've discovered their child's relationship with food, as well as for that parent in that situation to acknowledge the challenges that their child has about their body type, attractiveness, and so on and so forth as it relates to the influence from media. I also really appreciated Dr. Ricciardi's invitation for parents to consider reaching out to their child's pediatrician or any pediatrician in their community to find out if that provider has knowledge about the patterns of eating disordered behavior and the effects that the eating disorder can have on the youth's growing body. I really appreciate you for tuning in to today's podcast episode. For more information concerning Dr. Lindsay Ricciardi, as well as the resources that she advises and recommends for people to check out, please look in the show notes. Until next time, peace.